Congestive heart failure is when our heart does not pump enough blood to support our body. This does not mean our heart stops, it just means that it's not pumping blood the way our body needs it to. When heart failure occurs, blood and fluid can get backed up into the body, making it harder for our kidneys, lungs, and heart to flush out sodium and water. While becoming backed up and holding too much fluid, that can cause swelling in the heart and lungs. Congestive heart failure can cause shortness of breath, coughing, because of the fluid getting collected in our lungs, and that can potentially lead to other sicknesses or disease. Other symptoms can include tiredness, swelling, and weight gain. When ventricles can't pump blood to the body, over time, the blood and other fluids get backed up into other organs. The lungs, liver, and lower abdomen can suffer during heart failure. The organs don't receive enough oxygen they require, and that can cause more problems. Parts of the heart that can be involved with heart failure is the left and right ventricle. Generally, heart failure starts within the left ventricle because it's the main pumping chamber. The left ventricle moves oxygen-rich blood going through the left atrium, then the left ventricle. The left ventricle supplies most of the heart's pumping power, so it's the largest out of all the chambers and essential for normal function. The right ventricle then moves used blood out of the heart into the lungs to be replenished with oxygen. The right ventricle then pumps the blood back out of the heart into the lungs to be replenished with oxygen.
Congestive heart failure is a progressive, systematic illness that results in oxidative stress in diverse tissues, like an immunostimulating state with circulating inflammatory cytokines, wasting of soft tissues, and resorption of bone. Its origins are rooted in homeostatic mechanisms gone wrong to cause an imbalance. For example, marked accessory losses of calcium ions and magnesium ions accompany renin-angiotensin-aldosterone system activation, causing ionized hypocalcemia and hypomagnesemia that lead to secondary hyperparathyroidism with consequent bone reabsorption and a propensity to atraumatic fractures. Parathyroid hormone accounts for paradoxal intracellular calcium ion overloading in diverse tissues and consequent systematic induction of oxidative stress. In cardiac myocytes and mitochondria, these events orchestrate opening of the mitochondrial membrane, permeability transition pore within ensuing osmotic-based destruction of these organelles and resultant cardiomyocyte necrosis with myocardial scarring. Simultaneous with the calcium and magnesium ions, disruption of homeostasis is represented by hypozincemia and hypocelemia, which compromise metalloenzyme-based antioxidant defenses, while hypovitamosis D threatens calcium ion stores needed to prevent SHPT. An intrinsically coupled imbalance of intracellular calcium ion and zinc ions represent pro-oxidant and antioxidant, respectively. This is integral to regulating mitochondrial redox state. It can be uncoupled by a zinc ion supplement in favor of antioxidant defenses. Hence, the complementary use of nutraceuticals to nullify imbalance responses involving macro and micronutrients should be considered. Evolving strategies with mitochondria-targeted interventions interfering with their uptake of calcium ion or serving as selective antioxidant or MPTP inhibitor may also prove efficacious in the overall management of congestive heart failure. Homeostasis of the heart is adequate blood distribution to the tissues that is continually redirected to the tissues as they become more active, like when an individual is exercising. More blood will be directed to the muscles, the heart, and the lungs. In an individual with heart disease, whether they are currently exercising or not, this process is disrupted. It starts with atherosclerosis, which is a condition that develops when a substance called plaque builds up in the walls of the arteries. This buildup narrows the arteries, making it harder for blood to flow through. when blood pools in your blood vessel or heart from the lack of flow, the platelets are more likely to stick together, causing a blood clot. If a blood clot forms, this can block the blood flow even more and cause a heart attack or stroke. As heart muscle retains the buildup of plaque, it can limit blood flow even more, which can cause numbness and cold sensation in the limbs. You can also end up short on oxygen, which is also low blood oxygen levels. This can cause problems like dizziness, fainting, and shortness of breath. Your heart's rhythm might also get thrown off, and your heart might flutter, pound, or start to race. To limit the plaque buildup and reduce the risk of the symptoms of heart disease, things like diet and exercise can greatly help. Eating poorly, reduced exercise are main factors of developing heart disease. Therefore, countries that are unable to get healthier foods have a greater risk to develop this disease rather than other places.
When one suffers from congestive heart failure, the afflicted person's heart cannot keep up with the body's demand for blood. Thus, the blood returns to the heart faster than it can be pumped out to the rest of the body. Prevention of congestive heart failure can be simple. Through research and talking with your doctors, one can prevent themselves from suffering from congestive heart failure. As stated by the doctors of Johns Hopkins Medicine, stop smoking. Better yet, don't even start. A major factor of arterial damage and heart failure can be caused by smoking and/or inhaling secondhand smoke. Secondly, they say one should eat in heart-healthy ways. The foods that should be avoided are those that are high in sodium, and the foods that should be consumed are those which contain little to no saturated fats, trans fats, and sugars. This means that one should focus on maintaining a balanced diet, which includes fruits, vegetables, lean proteins, low-fat dairy products such as cottage cheese and yogurts, and good fats from olive oil, fish, and avocados. In addition to not smoking and regulating their diets, one should work out regularly and try to maintain a healthy weight for their weight, height, and age. The combination of these steps can help protect people's hearts from suffering from congestive heart failure.
Congestive heart failure has been a prevalent concern for civilians throughout the world for many years, as studies have shown that 64.3 million people around the globe have heart disease. Out of the cases that have been studied, some of the most popular regions that suffer from heart failure as a whole are the United States and Africa. There is a notable difference in both frequency of cases and treatment availability for congestive heart failure in America versus other regions throughout the world, such as Africa. It is estimated that around 5.8 million people throughout the U.S. suffer from congestive heart failure. One of the main culprits of heart disease in the United States is a poor diet, as there's an abundance of fast food restaurants everywhere we look. The consumption of processed foods, artificial sugars, and high levels of sodium all contribute to the risk of developing heart disease. However, many American cities have good healthcare systems that enable people to receive medications to help lessen the effects of their condition. While some regions in Africa possess good healthcare resources, as well as overall access to food with high levels of nutrition, this is not the case for many sub-Saharan areas. The lack of proper assets such as healthy foods, accessible healthcare, and the correct medications leaves a chunk of the population more susceptible to heart problems, displayed through heart failure's #1 ranking in disease-caused deaths in Africa. One of the biggest issues when it comes to congestive heart failure in many areas in Africa is that there's a limited amount of echocardiography resources, leaving many patients without proper diagnosis, which only decreases the chance of them receiving treatment. Although there are contrasting factors involving congestive heart failure in Africa versus the United States, there are also common denominators that increase the likelihood of developing a heart condition. Some of these include a poor diet, lack of exercise, as well as physical risk factors such as diabetes and hypertension. Therefore, regular exercise and eating a nutritious diet are essential for trying to avoid heart failure.